Welcome to This Explainer. Today, we're diving straight into something pretty heavy but absolutely crucial to uncover, a silent but deadly threat in long-term care facilities. We're going to examine exactly why families are so often misled about the true cause of these tragedies. We'll be looking at the hard realities of choking in nursing homes, pulling insights from legal and medical analyses of elder care, specifically drawing from the Paulus Law Firm's detailed breakdown of this hidden danger.
Okay, here's our quick roadmap for today. We're going to cover the hidden nursing home danger, high-risk choking factors, how these preventable tragedies actually occur, the specific legal responsibilities in Indiana, and finally, how to protect your loved ones. Let's get started. Section 1. The hidden nursing home danger. We really need to tackle a massive misconception right out of the gate here.
You know, when a vulnerable resident passes away from choking, it's so natural for families to ask, was this just a tragic accident? It's easy to assume that sometimes these things just happen, right? Especially as people get older. We often just assume nothing could have been done. But as we unpack the source material today, you're going to see exactly why that assumption is fundamentally flawed.
Here's the harsh truth we're uncovering today. Choking injuries in these facilities frequently stem from understaffing, a lack of proper training, and just systemic neglect. It is absolutely not a freak accident. It's a known risk, and it's one that requires active, daily management. When facilities drop the ball on monitoring folks with known swallowing issues, a totally preventable event turns fatal in minutes.
Moving on to Section 2, high-risk choking factors. To really grasp how these tragedies happen, we've got to look at the medical vulnerabilities that are incredibly common among nursing home residents. Let's start with a really important term you need to know: dysphagia. Basically, this condition makes safe eating a real challenge, and it demands very specific dietary care from the facility. You see, as people age, or if they face neurological conditions like a stroke or Parkinson's disease, the actual physical mechanism of swallowing gets compromised. It's a massive red flag, and the care facility absolutely must manage it proactively.
But you know, the danger doesn't stop there. Compounding health vulnerabilities dramatically crank up the risk. We're talking beyond just the physical mechanics of swallowing. Conditions like Alzheimer's or dementia can actually reduce a person's awareness of the food that's literally right in their mouth. Or think about physical frailty. Maybe they just can't sit themselves upright safely during a meal. Even really common medication side effects like extreme dry mouth or being heavily sedated, or honestly, something as simple as poorly fitted dentures can turn a totally routine lunch into a life-threatening hazard. And when these risks are just ignored, the consequences are severe. Failing to manage these vulnerabilities doesn't just lead to a brief coughing fit. It leads directly to blocked airways, irreversible brain damage from a lack of oxygen, and lethal conditions like aspiration pneumonia. And that's what happens when food or liquids are accidentally inhaled right into the lungs instead of safely going down into the stomach. It's terrifying.
All right, Section 3, how preventable tragedies occur. Let's look at how standard care completely breaks down, turning these known medical issues into fatal emergencies.
Choking injuries almost always stem from this domino effect of facility failures. It usually kicks off with something as basic as inadequate supervision, literally just leaving high-risk residents to eat completely by themselves. And from there, it just escalates, right? Ignoring modified diets, botching daily medications, delaying emergency responses, and sometimes entirely skipping crucial swallowing assessments. Let's zoom in on a few of these.
This one is a massive, systemic issue: understaffed facilities. Look, when places cut corners on staffing just to save a few bucks, the workers are stretched way too thin. So vulnerable residents who legitimately need physical help cutting their food into small pieces, or who just need someone to watch and make sure they're sitting upright, they get left completely alone. And rushing a meal for someone with dysphagia, that is incredibly dangerous. Another huge failure happens when kitchen staff or caregivers just flat out ignore strict dietary orders. A doctor might specifically prescribe pureed foods or specially thickened liquids that flow a bit slower so the person doesn't accidentally breathe them in. But if a rush staff member serves a regular meal or standard thin liquids to a resident whose chart explicitly forbids it, they are directly setting the stage for a choking event. And hey, it's not just about food. Even daily routines, like taking morning meds, become deadly if the staff isn't trained to administer pills safely. I mean, imagine trying to swallow a large dry pill when your throat muscles aren't working right and your medication gives you chronic dry mouth. Staff absolutely must be trained to know exactly when to crush tablets, when to use liquid alternatives, or just making sure the person has enough water to safely swallow. Okay, Section 4, legal responsibilities in Indiana.
Now that we understand the systemic failures, let's examine the actual legal framework that holds these facilities accountable.
Nursing homes have a strict legal obligation to provide a safe environment. The law actually links very specific duties to actionable negligence. So if the facility's duty is to assess a resident's choking risk, failing to bring in a speech-language pathologist, that's negligence. If their duty is to maintain adequate staffing, leaving high-risk residents alone to eat is actionable. And if their duty includes emergency training, having a staff that literally can't perform CPR or the Heimlich maneuver when every single second counts is a massive liability.
But here's the catch. Accountability isn't just automatic. In the legal world, families actually have to prove that the facility's failure to meet its legal obligations directly caused the injury or death. It's about drawing that direct line. If that direct line of negligence is proven, then families might be able to recover damages for things like medical expenses, pain and suffering, emotional distress, and the heartbreaking loss of companionship.
Because proving negligence is super complex. And believe me, these facilities will aggressively defend themselves. This is exactly where an experienced nursing home attorney steps in. They do the heavy lifting, securing medical and dietary records to see if care plans were totally ignored, consulting medical experts like speech-language pathologists, and critically, analyzing the facility's past violations with the State Department of Health to see if there's an established pattern of neglect. Which brings us to our final part, Section 5, Protecting Your Loved Ones. Let's talk about the concrete, actionable steps you can take today to prevent these tragedies from hitting your family.
Consider this your essential family action checklist. First, ask the facility point blank. Has a speech therapist evaluated my loved one? Physically look at the care plan yourself to make sure dietary restrictions are clearly documented. Stick around and observe a few meal times to see if they're actually getting the help they're promised. Document any time you see them coughing severely during meals. Honestly, just being present and engaged can literally save a life.
And if you start spotting red flags, do not hesitate to use outside resources. The Long-Term Care Ombudsman is an incredible tool. They're a completely free, neutral advocate, specifically designated by law to investigate your concerns about neglected care, staffing shortages, or improper feeding practices. Seriously, use them. They are there for you.
So, as we wrap things up, the biggest takeaway from our explainer today is this stark contrast. The myth that facilities want you to believe is that a choking death is just a tragic, unavoidable accident of old age. But the reality, backed by medical standards and the law, is that it is so often the direct result of preventable neglect and completely ignored medical protocols.
It all boils down to a pretty harsh truth. Understaffing and skipped protocols happen when a facility decides to place profit above patient safety. So if your loved one suffered from poor care, you've got to ask yourself, are you ready to look past their excuses and demand the answers and the accountability they truly deserve? Stay empowered out there, and thanks for joining me for this explainer.